I'm Dr. Ruthie, a professional sexuality educator, a blog over at exploringintimacy.com, and I'm the author of The Nice Girl's Guide to Talking Dirty. But today I'm here with funwares.com answering your questions about sex and relationships. I hope you'll send your questions in to me at Ask Dr. Ruthie, AskDrRuthie at funwares.com, or you can just tweet me at Dr. Ruthie, same spelling. All right, here's a very short and simple question that came in as a comment to one of my earlier videos. That video was sex Q&A. I want to taste my ejaculate, but I just can't. Somebody responded to that and asked, can you catch a disease by eating someone else's cum, also known as ejaculate, semen, all that good stuff? And the answer to that is yes, but I'm going to give you even more information than that. There's a lot of concerns about STIs, sexually transmitted infections, or STDs, which is what we used to call them, sexually transmitted diseases. Now we say STI more often, with oral sex. Now, generally speaking, unprotected oral sex is a lower risk activity than unprotected penetration, vaginal or anal. However, just because it's lower risk doesn't make it safe or a safe alternative in intercourse. I'm sorry to break your hearts. I know that a lot of folks, young adults, old adults, middle-aged adults, really count on oral sex with the mistaken belief that it's a risk-free way to experience pleasure. It's not. You don't run the risk of pregnancy, regardless of the genders involved, when you have oral sex, but there are other risks that come along with it. Some of the risks that we're seeing now have to do with HPV, which is a sexually transmitted infection that's associated with cervical cancer and also mouth and throat cancer. The risk of getting the kind of HPV that leads to cancer is pretty small, but the consequences are really, really huge, which is a very good reason that all of you should be going to the dentist regularly, because they can look under your tongue and check to make sure that, do that little oral cancer check for you. So this is comes from oral sex on anybody. It can happen. It requires that the person you're giving oral sex to does have HPV. If they don't have any sexually transmitted infections, then they can't give them to you. But there's no way to look at your partner, at their genitals, at their body, at their mouth, anything, and know if they have a sexually transmitted infection. It's an infection. So perhaps, you have had a cold and you thought to yourself, I wonder when I got this cold, and you thought back, a couple days ago or whatever, and you were near somebody with a cold, but you didn't realize the cold infection was in your body right away, and then later you got sick. So it's the same sort of thing, except in a much longer time span. You can have a sexually transmitted infection and not have any way of knowing it's in your body, and no one around you would know either, until the point that symptoms start to show. But with some sexually transmitted infections, that can take months or years. In fact, there's a couple of infections out there that for some folks really won't have any symptoms, but they can cause sterility and other problems in their partners. So this is really important to know. There's no way to tell if someone has a sexually transmitted infection. Now, some infections will sometimes have symptoms that you can see, but that's not a safeguard against all the infections or against somebody who's more recently infected or between outbreaks. There's two different ways that you can get sexually transmitted infections from a partner if you're giving them oral sex. The first is skin-to-skin contact. So the skin of your partner could carry some nasties in it that you could get on your skin. You might not be able to see the nasties when you're looking at them, but those infectious things could still be getting on your mouth and your lips and in your mouth, and if you rub your eye, it could get in your eye, all kinds of terrible things. The other way is through sexual fluids. So whether your partner has a vulva, vagina, clitoris, or whether they have a penis and scrotum and all those things, their sex fluids can also carry different infections that can get into your body through your mouth. And again, if you wipe your eyes or you touch their parts, then you touch your parts, those things can transmit that way too. It's absolutely essential that you consider and talk about using protection with all of your partners, including for oral sex. That means using a condom if you're giving oral sex to someone with a penis, or using a dental dam, and some folks even are okay with using plastic wrap if you're giving oral sex to a female partner. Don't just ask somebody if they're clean. Everybody thinks that they don't have any STIs until they find out that they do. And they may not tell you the honest answer, to be honest with you. So you need to kind of see those test results for yourself and know how recent they are. But the best thing to do is really just to use those universal precautions by always using protection. So yes, you can definitely get something from swallowing someone's cum. It's not safe. People also ask me if they can get something from eating their own cum. if you don't have any diseases, you can't give anyone else any diseases, and you can't spread them. Now, as funny as it sounds, there could be some, bacterial or issues in your own semen if you do have an infection that could move up to your mouth. Yeast and things can move up that way. If you touch any sores, then you touch the sores to your mouth. You can transmit them from one place to another. But there's nothing inherently contagious about sex fluids. It's the fact that they carry contagions that we've caught from other people, from one person to the next. I hope that makes sense and that answers your question. I'm Dr. Ruthie. If you need more information about sexually transmitted infections, you can call your local health department if you live in a country that has them. You can even call the CDC if you live in the United States. Just Google it, you'll find it. And definitely talk to your healthcare provider. If you're not comfortable talking to your healthcare provider about these topics, you need to find a healthcare provider that you are comfortable with speaking to about these topics, because that's very important, and you deserve that good quality kind of healthcare. I'm Dr. Ruthie, and I'll see you with the next video.